Hello friends, I am Dr. Mayank Gupta, Senior Consultant and HOD at Dharamshila Narayana Super Speciality Hospital. I would like to talk about today the most common problems faced by men and women in urology. So as we all know that urological problems are more prevalent in men and women than they are thought of, and they affect the quality of life of both men and women equally. So both men and women can have urological problems ranging from minor infections to even cancers of the kidney, bladder and urinary system and reproductive system. Early recognition of the symptoms and timely medical attention is the key to the effective treatment and long-term urological health. So when we talk about the urological problems, the most common problem in OPD is what we face is the UTIs, or what we call as urinary tract infections, which are more common in females than men but can equally affect both of them. And that includes increased frequency of urination, burning, fever, pain, bleeding in urine or hematuria. All these symptoms, cloudy urine, all these symptoms, they lead to UTIs and can cripple the patient's life for days and even weeks together. So the treatment involves effective management, conservative management or operative management, whatsoever is required to treat the infections. It is more common in diabetic patients than non-diabetics. The second issue which is faced by men, not women, is the prostate health. And prostate disease or the prostate symptoms can range from increased frequency of urination in day or night or both times, slow urination, difficulty in urination, bleeding in urination. All these symptoms, their recognition leads to the diagnosis of prostate related health or prostate disease. It could be either benign, that is BPH, or it could be cancerous, that is prostate cancer. The next set of problems faced by both men and women is kidney stones, which can occur in any age group, right from a child of 3 to 4 years or maybe even lesser than that to around 60, 80, 90 years. Any age is no bar for stone formation. So the effective treatment involves timely detection by doing ultrasonography almost yearly, and in all talks I strongly stress that every citizen of the world or every citizen of the country should have an ultrasound at least once or twice a year, so that he can diagnose the disease at an appropriate time to prevent any further damage to his system. The next growing concern of the disease is about urinary incontinence, especially in older adults and older women, older men and older women, but even in children also. And the people suffering from can have interstitial cystitis or overactive bladder or bladder control issues, which can lead to social embarrassment and reduced morbidity or reduced confidence in most of the persons who suffer from urinary incontinence. So the good news is that all the conditions which I have enumerated earlier, they have effective treatment and management if you consult a urologist timely. So it is advisable that the people should recognize the symptoms and go to their urologist to get it diagnosed and treated. The urologists have all the tools nowadays, including the blood tools, the ultrasound, uroflowmetry, the CT scans, the MRIs, by which they can all diagnose all the diseases, and almost 99.9% of the diseases can be diagnosed and treated by the urologist nowadays. Once the disease is diagnosed, the urologist, the surgeon has all the amenities with him nowadays to treat it. He can give you a conservative management in the form of medication or urological surgical procedures, which include laser procedures, which include endourological procedures, robotic surgeries, or open surgeries, or laparoscopic surgeries, advanced laparoscopy. All these procedures can get the patient treated with a high efficiency, so that his life becomes easier and his early return to work is ensured. So in short, if I say that the consulting a qualified urologist can make a world of difference, whether it is a common UTI or an advanced disease like prostate cancer, bladder cancers, or kidney cancers. They all can be treated and managed very effectively nowadays. So the patient should realize their symptoms earliest. They should be aware of the symptoms and should consult their doctor regularly, so that they can prevent damage to their health and organs. Thank you.